This is for nasotracheal suctioning. So we're going to first check the patient's chart and make sure that the order is in place. We are going to make sure we have suction set up in the patient's room as well as our oxygen and our device to use for the oxygen. And then we're going to take a sterile suctioning kit with us. We would go to the patient's room, knock on the door, introduce ourselves, sanitize our hands. Hello, Mr. Blank. My name is Trisha. I'm with Respiratory Care. Today we're going to do some suctioning. You have your nasal airway in place, and we're going to use a catheter, enter it through the nose there and get some secretions out for you, kind of assist you with that. So can I get your name and date of birth? Okay, so the first thing we want to do is we want to hyperoxygenate the patient. So we would have our oxygen set up. I might have a little bit different setup today, but I'm going to go ahead and set up the oxygen. As the patient is oxygenated, we will get our vital signs. We are going to make sure we have the pulse oximeter with us, and Mr. Blank, we're going to keep this on your finger through the entire process. So that way you want to watch the oxygen level. If it would happen to drop, you want to stop what you're doing. Maybe feel the patient's chest, ask for permission. Go ahead and feel their chest because you may feel those secretions across the chest there. So then hands are sanitized. You're going to go ahead and get your supplies ready. So you have your sterile kit you're going to open. You have your suction catheter, you have lubrication, and then you have a little cup for your sterile saline. You want to dump that sterile saline into the cup. Go ahead and put our gloves on. Actually, you would put the gloves on and then you would open the other things to keep it sterile. So sterile gloves, I'm going to try and keep one hand sterile and one hand clean through this process. So we've got sterile hands right now. Go ahead and pick up that catheter from the kit. We're going to attach that to the suction on the wall. We're going to have that suction set at -100 to -120 for this adult. And then we're going to make sure that the suction is working properly. So we would take the catheter tip, put that into the saline, and occlude the thumb port to make sure that the saline is coming back up through the tubing. That makes us know that the suction is working correctly. Then we would use the lubrication. We would have opened it and put it on the sterile tray or in the palm of our hand. And then we would go ahead and lubricate the end of that tip. So then what we're going to do is we're going to remove that oxygen. So Mr. Blank, I'm going to remove the oxygen, and then we're going to advance the catheter through the nose. So I just need you to breathe normal, relax as much as you can, and I'll instruct you to cough if you don't cough through this. So, all right, so we want to advance the catheter. Do not put your thumb on the thumb port yet. So slowly advance that catheter in through the nair. First resistance, you're going to have the patient cough if they haven't already. This is where it's hitting the vocal cords. We'll have them cough, and then we'll push it a little bit further. That second resistance is in through the carina. We're going to pull back slightly, and at that point we're going to occlude that thumb port and start twisting that catheter. We'll twist that catheter as we're removing it. We want this whole suction process, that your thumb is on that thumb port, to be less than 10 seconds. The entire process itself from entering to pulling back is going to be 15 seconds. So we've removed that. I'm going to keep this hand sterile here, and I just want to feel the patient's chest. If we felt that and we had secretions, felt that movement before, we're going to feel that. If that has cleared, we could go back in for a second time if we wanted to, but we only want to do two in one setting. We're continually monitoring that oxygen level. We've completed our suctioning, so we will discard that. Then we're going to re-oxygenate the patient. So Mr. Blank, I'm putting that oxygen back on for you here. Okay, and then we're going to reassess the patient, get our vital signs. Like I said, we felt the chest. Then we're going to leave that on for 1 minute. All right, Mr. Blank, then we're going to answer any questions that Mr. Blank has, make sure he's comfortable, and we're going to dispose of all of our items, and then we will document in the chart what we've completed.